Hi, my name is Shea. I'm the nurse practitioner here in the office. Can I get your full name?
Yeah, it's Zachary Julian.
Okay, Mr. Julian. Do you go by Zachary or Zach?
You can call me Zach.
Zach. Okay. Um, Before we go over a couple things, I just want to ask you just some little questions. Um, can you verify that this is your birthday, 10/25/91?
Yes, that's correct.
Okay, and is this your address?
Yes.
Okay, great. So before we talk about what brought you in today, I just want to tell you how this appointment's going to go. Kind of just going to get a health history and ask you about some surgeries you've had in the past, some medications, those kinds of things, okay?
Okay.
Alrighty. What brought you in today?
I just came in for a yearly checkup.
Oh, okay. How has this past year been for you?
Pretty good. There's been no major issues.
Okay. I see here in your chart that you lost a little bit of weight from your last visit. Are you feeling okay?
Yeah, I've just been watching what I'm eating and eating clean.
Okay, well that's awesome. Good for you. So I'm just going to ask you kind of about your overall health. Have you been experiencing any headaches lately?
No, I haven't.
Have you had any recent head injuries?
No.
Okay, good. What about any numbness and tingling in your fingers or your toes?
No, I don't have anything.
Okay. How's your vision been?
It's been fine. Still 20/20.
Oh, wow, that's great. Good for you.
Mm-hmm.
Do you wear any contacts or glasses? Obviously not, because you have 20/20 vision. What about any nasal congestion or any issues with your sinuses?
Nothing
I know
really
it's
normal.
Okay.
Just allergy season.
Yeah. Do you have any allergies, like seasonal allergies?
Seasonal, yeah.
Okay. What about any change to your taste or your smell?
No, nothing like that.
No. Okay, great. Have you been experiencing any chest pain, any palpitations that you feel in your chest?
No.
No? Okay, how's your breathing?
It's fine.
Yeah?
No issues, no wheezing.
Okay. Do you have any difficulty when you take big deep breaths or any pain when you take deep breaths?
No, I don't.
No? Okay. How is your digestion? Are you having pretty frequent bowel movements?
Yeah, nothing out of the norm.
Okay. Are you nauseous lately, or are you experiencing any vomiting after you eat certain foods, or?
No, I just have to watch my dairy, that's all.
Okay. Is that something new for you, or
No.
has that been pretty?
Yeah, I've had issues with dairy for years, so I just avoid it altogether.
Okay. Do you get heartburn from any foods?
No, I don't.
No? Okay, great. What about your bones and your joints? Do you have any pain in your bones or joints or anything?
No. I mean a little bit. I take fish oil. It kind of helps.
Okay, great. Did you just start taking the fish
I've
oil?
been taking it for a couple months. I've noticed a pretty big difference.
Oh, okay, that's great. Same with muscles. Are you having any muscle pains or muscle spasms?
No.
Okay. Did you have any before the fish oil?
No, I haven't.
No. Okay, good. Are you having any problems with urination? Having any difficulty going or frequency in urinating?
No.
No?
I've been drinking plenty of water, so no issues.
Okay. Do you experience any? I know you said that you were doing a change in your diet. Because of that, have you experienced any new weakness anywhere?
No. It's pretty. I've been making sure I'm getting all the necessary food groups. So, if anything, I just haven't been consuming as much salt. So
Okay.
It's been better.
Well, that's always a good thing. Yeah.
Mm-hmm.
Now I am going to ask you a little bit about your sexual history, if that's okay with you.
Yeah, it's fine.
Okay. Are you currently in a relationship?
Yeah, I'm married.
Okay. Are you heterosexual or homosexual?
Heterosexual.
Okay. Are you and your wife, are you guys sexually active?
Yes, we are.
Okay. Are you using a barrier method, or are you guys wanting to start a family? Or
We started a family, and we're probably going to have some more children, but sometimes we do use condoms.
Okay. Right. How have you been feeling your mood overall?
I'm fine. Yeah.
Yeah.
Everything's been fine at work, and I have really no issues whatsoever.
Okay. And how are you feeling right now that you're in here?
Content.
Okay. Are you sleeping okay? Are you getting good hours of sleep?
Trying to get 7 to 8 hours.
Okay, that's good.
Mm-hmm.
And you're staying asleep during those 7 to 8 hours? Do you have a hard time falling asleep or staying asleep?
I mean, every now and again, I have a hard time staying asleep, but I fall asleep pretty quick, so no issues.
Okay, good. Now I'm going to ask you about your surgical history. What are your past surgeries?
In 2008, I had my right meniscus repaired.
Okay.
And everything was a full recovery. I didn't have any issues. And last year I had to get a colonoscopy.
Okay.
There were just some. My sister had some tests done. I'm not a doctor, so I can't tell you everything that they found, but I guess there's some abnormalities, so they wanted me to get a colonoscopy just because we're related to one another.
Okay. So actually now following up with your medical history, you said that it was your sister that had some issues? They just found some abnormalities?
Mm-hmm.
Okay. And how did your colonoscopy come back?
It was fine. There
Came
were
back
no
negative.
issues. Yeah, negative.
Okay. Do you have any brothers?
No, I don't.
No brothers. Okay. Do you just have the one sister?
I have two sisters.
Okay. And what about your other sister? Did she have to have this colonoscopy done?
She had one done as well, and it was negative.
And hers was negative also. Okay. Are your mom and dad still living?
Yes, they are.
Okay. Do they have any histories of a heart attack?
No, they actually don't really have any negative health history.
Okay. I'm just going to rattle off some things and go ahead and tell me yes or no if they've experienced them.
Okay.
What about like a heart attack?
No.
Are either one of them anemic?
No.
Do they have high blood pressure?
No.
Any history of a stroke?
No.
Okay. What about history of cancer?
No.
Any issues with thyroid?
No, not that I know.
Okay. What about any issues with kidney?
No.
Do either one of them have diabetes?
No, they don't.
Okay. What about asthma?
No.
Okay. Then what about something else? It's called COPD. It has to do with like their breathing.
Yeah, their breathing's normal.
Okay. Are your grandparents still living?
Not all of them, but yeah, my grandmother on the maternal side, and both grandfather and grandmother on my dad's side.
Okay. So your grandfather, he passed away. What did he pass away from, if you don't mind me asking?
It was just due to a mental health issue.
Okay. And your grandmother, does she have any of those medical issues that I just named off? Maybe she had a heart attack?
she hasn't really had any medical episodes, but she doesn't really take care of herself as good as she probably should.
Okay.
It's basically obesity, overweight.
Okay. And what about your other grandparents on your father's side?
My grandfather has like a minor heart issue.
Okay.
I don't know the exact procedure he had done, but everything seems to be working properly. He's never had any other health issues. My grandma doesn't have anything.
Okay. All right. Well, thank you very much for that. Are you taking any current medications? I know you did say that you were on fish oil.
Yeah, I just take a multivitamin, just the men one a day. Take zinc, fish oil, and vitamin D.
Okay. Do you take any over-the-counter medications? That would be anything such as like Tylenol, Aleve, Advil. Do you take any of that's a
Not
like
regularly.
not regularly?
Just if I have a headache or pain or something like that, just as needed.
Okay. Do you take any herbal supplements?
No, I don't.
No. Okay. And what about any recreational drugs?
No.
Okay, Zach. I know you said earlier that you do have some seasonal allergies. What about any food or drug allergies that you know of?
Just lactose intolerant, I guess.
Okay. Okay. Now I'm going to ask you a couple of questions about your social aspect of your life. What did you do? What do you do? What is your occupation?
I'm a state trooper.
Okay. Do you work here out of Mercer County or Lawrence County or?
I work out of Lawrence County right now.
Okay. And How is that for you? Is that stressful?
It can be, just like any other job.
Okay. Have you found ways to help with your stress or manage your stress?
Yeah, I don't really get really stressed out, to be honest.
Okay. I'm not sure how police work is. Do you work 12-hour shifts? Do you work 24s? Do you
8-hour shifts?
8-hour shifts? Okay. Do you work any overnights?
No, I don't.
No. Okay. And you did say that you were married. Do you and your wife, do you guys live together?
Yes, we do.
Okay. What kind of house do you guys have? Do you guys have a house or do you have an apartment?
It's just a small townhouse.
Okay. Is it a 1-story or 2-story?
2-story.
Alrighty. And is this your guys' first house together?
It is, yes.
Okay. And what about any pets? Do you guys have any pets?
Yeah, we have 2 dogs. We have a Vizsla
Oh.
and a bulldog beagle mix.
Oh, okay. You have to show me some pictures of them one time.
Okay.
And kids. I think that you mentioned that you had some kids earlier.
1 kid, yeah.
You have 1 child. Okay. Do you have is it a little boy or girl?
Little boy is almost a year.
How exciting! It flies by, doesn't it?
It does.
I know my little boy. He's going to be 1 also. Do you smoke?
No.
No. Okay. Do you drink at all?
Occasionally, just a social beer, nothing more than that.
Okay. About how many do you think a week?
I don't even know if I have a beer every week. Maybe every other week I might have a couple.
Okay. And you earlier you said that you did change your diet and you're eating more clean.
Mm-hmm.
So any processed foods, any fast foods, anything like that?
No.
Good.
Yeah, usually a lean meat, vegetable, or rice.
Good.
Eggs, fruit smoothies, salads.
Okay, good. Just one thing, just be careful with your eggs. You don't want to have too many. They can raise your cholesterol up. I didn't see you have any lab work done today, so that's okay. We'll get you the next time that you come in. And also just watch your meat also. That can cause your cholesterol to go up. But you said you eat kind of a balance of
Yeah, it's a pretty good balance.
chicken and fish and all of that. Good. And do you exercise?
I do.
Okay, how often?
Like 5 to 6 days a week.
Wow. Do you ever get a rest day between that and work and a 1-year-old? Oh my goodness.
Sundays.
Sundays, yes. Alrighty, Zach. Do you have any questions for me?
No.
Is there anything that is that's bothering you, or?
Is there anything you think that's concerning?
I really don't. I think you're in the right steps to taking really good care of yourself. I tell my patients it's never too late to start eating healthy and exercising, and you seem to have that down. And I wish you and your wife the best of luck on continuing your family.
All right, thank you.
All right, you're welcome.